Hi, my name is Nina Schwalbe, and I'm a UNU-IIGH Principal Visiting Fellow. Impactful, invigorating, exciting. My experience with UNU has really changed how I think about scholarship and the impact scholarship can have on policy. Working together with a highly competent, highly motivated, highly dedicated group of professionals from around the world based in Malaysia has expanded my perspective on thinking about what is evidence and what makes evidence impactful in terms of its impact on policy. The highlight of my engagement with UNU-IIGH has been thinking through policy and strategy and where we can make a difference, and I think probably the most impactful example that I can give of that is the work together on pandemic preparedness and immunization and global health. From pandemic preparedness, thinking about what we can do to better monitor pandemic preparedness and make sure that there's a range of stakeholders engaged in that monitoring. That's where UNU-IIGH really has the power and has shown that it can bring together a wide range of stakeholders, not only, and in particular, not only the regular people that come to the table from the UN agencies, but they bring those people as well as donors. But most importantly, they bring the voices from the global south that really need to be at the table. My experience and my expertise is really in the area of immunization, vaccines and immunization. And I think that the work that UNU has done with regard to gender and immunization is really critical and groundbreaking. So, thanks to that checklist that's been developed by UNU, there's a new way of thinking about access to COVID-19 vaccines for women. COVID-19 vaccines have not been distributed equally globally. The global south has suffered from a lack of access to COVID-19 vaccines, and we have very little data on women and the extent to which they've also been able to receive or had access to COVID-19 vaccines. UNU has done a checklist, and I think it's a great example of the type of policy change that makes a difference. And when I was recently serving as the director of vaccine access and delivery for the US government, we actually put that checklist into place and made it a mandatory tool that our colleagues in countries had to use in order to assess how COVID vaccine rollout was going. So I think the incredible ability to synthesize evidence and make it policy relevant is a direction where UNU and its team have shown massive impact, including and importantly to help us through the COVID-19 pandemic.